It is an honor and a privilege to introduce our guest panel here today. We have Sue Schmid on the right, our right, Bella Wong, and Dr. Rob McGee. They're going to share with us how faith, hope, and science was so critical in their survival on their journey. So we'll start out with Sue.
Do I have to stand up or can I just sit here? All right. I don't think I have to turn on. Oh, thank you. I was going to do that. My name is Sue. And I was just hoping for that. I needed a little levity. I'm way, way out of my comfort zone here, so just bear with me. And you need to know that you are all naked. Did it go? No. Put it on my chin here. Did I move around too much?
Do you want to just use this microphone?
Yeah, use the microphone.
Okay. There you go.
So, I started out to say I have emphysema. It sounds so much better if you say COPD, but it is, in fact, in my case, emphysema. I grew up in a family of smokers, and of course, I guess I just thought that's what you did when you grew up. So, my mother had emphysema. My father used to get up in the mornings and he had a smoker's cough.
You want to try this?
Okay. Is it on?
It's on.
Okay. I'm such a problem child. He had a smoker's cough. And he died when he was 53. So he probably would have been diagnosed with emphysema, but he died of a heart attack. And I had one brother that died at age 41 from a brain aneurysm. So I think I'm lucky to be here. I wish I'd never started smoking, but I did, and so here I am. After I was diagnosed, I saw an advertisement at National Jewish Hospital for studies. And so that was the first part of my journey into my recovery. I think the first one I did was a Spiriva study it was a 3-year study, way back, and also the Alpha-1 study. Excuse me. After that, I have to look here. After a couple of ER visits, emergency room, and a couple of exacerbations, my primary care physician said it was time for me to see a pulmonologist. And the first thing he did was put me in pulmonary rehab, which was probably the best thing that could have happened. And within a year or two, I had lung volume reduction, where they removed the top part of my lungs, removed damaged tissue. That was great help for a few years. That was in 2007. In 2015, I got a transtracheal oxygen put in at National Jewish. And I think that's been another huge help to my breathing. I need to drink water. I get so nervous. My mouth gets dry. I get shaky. I can't talk. There are so many things I'd like to tell you. I know that's not enough time. As the disease progressed, we kept finding new things to make breathing easier. Like I said, the last one was transtracheal oxygen, but the biggest thing was the pulmonary rehab. And from our pulmonary rehab came the harmonic hats and the yoga, and now they even have the Tai Chi. It also became our support group. It's the family that we all just kind of take care of each other. The pulmonary rehab became our classroom where we learned more about our diseases. It became our support group. We learned from each other about our diseases. And of all the, there are so many different kinds of support that we have and resources. And I want to mention I have a great husband of 52 years who has taken good care of me. He's my Uber driver. He keeps my oxygen machines, all my machines working, and fills my water bottles and does all those things for me. So he's a great support too. And I guess what I want to finish with is that they're always coming up with something new. Just when you think they can't do any more for you, they come up with something else. So it's important to find a support group, stay close to your doctors, your RTs, find out what's on the horizon, and just don't give up. Just keep plugging away like we do. Okay?
Hello? Oh. Sorry, I'm loud to begin with, so. I also have a tendency to talk really fast, so if I do, let me know. I'll slow down. Slow down? Just for you, Anne. So my name is Bella Wong. So let me take you back about 11 years, 2007, prior to any type of lung disease or respiratory illness or any type of health issue that I've ever had. At that time, I was 29, maybe about a month or two before my 30th birthday. I was living in Southern California, in Huntington Beach, California. I was extremely active. I was not only working about 50 hours a week, I was in upper management for a retail company. In fact, a week before I got sick, I was supposed to be promoted to a district manager. I was raising my niece. I had her from when she was 3 months old, and she was 13 when I got sick. I was very active into sports, playing beach volleyball on the weekends. I would run anywhere between 1 mile to 5 miles a day, just a very active person, and that was my quote-unquote normal life. And the weekend before Labor Day, I was having issues of shortness of breath. A couple days went by and I said, this is not normal. I was having shortness of breath just walking from my car to work, just to the building. That's not normal, especially if I'm running anywhere between 1 to 5 miles a day. I wasn't even that short of breath then. So I decided to go to the emergency department. They put me on about half a liter of oxygen when they admitted me, and they had no clue what was going on with me. That was the only side effect I had, no other side effects. No cough, no dizziness, my lips weren't turning blue, nothing, just shortness of breath. But my saturation was at about 87%, so that's why they put me on about a half liter of oxygen. So while I was there, I was progressively getting worse. Just to give you an idea of how quickly this was going, within, I would say, about 10 days, I went from half a liter to 15 liters of oxygen. And they still could not figure out what was wrong with me. They asked me every single question they could think of. Do you have any animals? No. Do you have a bird? I'm thinking, well, isn't that an animal? But, the only thing I could think of is, unless of course you consider the children that I'm raising, I don't have any animals. I didn't have time for that. I had previously gone on a trip with my family. We were originally from Hawaii. We had gone back about 2 months prior, so they thought it might have been something in the air there or something I ate. It wasn't any of that because it was 2 months prior, and if that were the case with how aggressive my illness was, it would have started sooner. So moving forward, I did 2 biopsies. The first one was a bronch. They couldn't figure out what it was. Then the second biopsy, they went in and they had to go, through the side and take some tissue out and send it to the lab. Well, they sent it to the hospitals in LA. They couldn't figure it out. They actually had to send it to a doctor in Syracuse to figure out what I had. In the interim of the second biopsy, I actually ended up going into acute respiratory failure to where they ended up intubating me. And this is kind of where it started out to be a scary ride. Because I'm going in thinking, okay, I'm going in for a biopsy. After anesthesia wears off, 2-3 hours later, I'll be up. They're gonna tell me what's wrong with me in a couple days, right? Wrong. My parents had recently moved from Hawaii to Colorado. And my mom even said, hey, do you want us to come out there for your biopsy? And I said, no, it's an easy procedure, no problem, don't worry about it. So when I did wake up thinking it's about 2-3 hours later, it was actually a little over 2 weeks later. Because not only had they intubated me, but just for, my safety and just for mental state of mind, they put me into a medically induced coma for 2 weeks and blasted me with steroids. And so when I woke up, I see my mother standing in front of me. I knew something was not right because I told her, don't worry about it. Don't come out here. I'm good. I'm a tough cookie. But yet she's standing in front of me, and it takes at least, an hour and a half, 2 hours to fly out to California? So I, at that moment, knew something was not right. I couldn't talk. I had so much steroids in my system that I had completely atrophied to where I couldn't even move my arms around. It was the scariest moment in my life. I didn't know what was going on, yet alone ask what's going on. So it turns out I was diagnosed with what they call BOOP, bronchiolitis obliterans organized pneumonia. Has nothing to do with pneumonia. What it is my body was looking at my lungs like it was a foreign substance, almost like, say, someone gets a lung transplant and the body's attacking it because that's not your organ. That's what my body was doing. And that's why it was so aggressive. To this day, they don't know how I contracted BOOP. It's idiopathic. And I'm not necessarily concerned how I contracted it, unless, of course, just to make sure that I don't get it again. But I have wonderful doctors too, where I'm not worried about that. So moving on, I then had to go through rehab. I had to build my strength up. So many things that you take for granted when you're healthy. I had to relearn how to breathe in order to get extubated. They sit there and they test you for however many minutes to see that you are taking the right amount of breaths, that you're not breathing too quickly. That way you're not stressing out your heart. Just so many factors that go within, all of these tests that they do for your benefit. And I had to go through physical therapy. I had to not only, once again, learn how to breathe. I had to learn how to brush my teeth. I had to learn how to sit up. I had to learn how to stand up and walk with a walker before I could even consider going home. And so that hospital stay actually ended up being 5.5 months. I actually got to spend my 30th birthday in the hospital, so that was very interesting too. I don't know how my sister rigged it, but that hospital has semi-private rooms. Somehow they got rid of my neighbor, and she threw a surprise party. Real hard for surprise, right, when you're stuck in the hospital and you don't know what's going on outside, but had the full birthday cake and everything else. I even got a pretty pink tiara that lit up. And I went home, and I've been very blessed with my family. I'm the youngest of 5 children. And as much as we are spaced out in age, closest one is 5 years older than me, we are very close. My father, in fact, moved temporarily from Colorado to California to help me get back on my feet. He stayed with me for 7 months, took my niece to school, fed us. In fact, he was at the hospital every single day for me. He would drop my niece off at school, he would come and visit me, go through PT, and he told me, because several years prior he had broke his back to where they had told him, "You will never walk again." And guess what? He was pushing me around in my wheelchair. And he told me, "You know, I think the reason why I broke my back is so I could help you get through this tough time. And if it weren't for him, I don't think mentally that I would be able to do it." And I think that's what this game is. I tell a lot of people, it's not the breathing part, it's the mental part that always gets you. You're the one who always psychs out yourself. You need to be mentally strong. And that's not going to be 100% of the time, but you need to surround yourself with people who are going to keep you mentally strong in the right frame of mind. And so, unfortunately, I did not do better after the 7 months. And my pulmonologist told me, "Have you heard of National Jewish?" I had no clue what National Jewish was. I had recently come onto my illness. And so I actually moved from Southern California to Colorado. And everyone asks me, "Why would you do that? Do you know what the altitude does to your breathing?" I had no clue. I found out real quick. So I was actually paired up with a doctor at National Jewish. I was actually very blessed. I don't know if any of you know Jeff Swigris, amazing doctor. He taught me so much, not just about my illness, but how to be an advocate for myself. He actually, with how aggressive my illness was, suggested that I go on chemotherapy, which was a shock to me. Because when you think chemotherapy, you think cancer. And I said, "I don't have cancer." But apparently the type of illness that I have, they have found that patients in the past responded well. Unfortunately, I'm not a normal patient. I never have the normal symptoms. When they say, even on a medication, this is what normally happens, this is what sometimes happens, this almost never happens, I'm always the "this almost never happens." So he put me on chemotherapy. I did it for about 6 months. Was not easy. Unfortunately, like I said, it didn't work for me. So we did other infusions like rituximab, which actually did wonders for me. Unfortunately, in 2009, I had a real issue with severe edema. I mean, to the point to where I couldn't put slippers on. And I was even trying on my brother's, and now my brother is 6'4", real Hawaiian-looking guy, wears a size 14 shoe. I couldn't fit my foot into his slippers. That's how much edema I had. And I had noticed that one arm was slightly discolored than the other. And so I went to my provider. Unfortunately, he was not there, so I got a nurse practitioner, and I had told her, "You know, I have this edema, one arm slightly discolored." And she was like, "No, it looks fine to me." You know, so I figured, well, they know what they're doing, right? You need to be your own advocate, because I decided to go back to Dr. Swigris, even though he's a pulmonologist, and I showed him, and he looked at me and he said, "Well, let's run a test. But just out of curiosity, what are your plans for this weekend?" I hear a lot of groans. So we all know what that means because we've heard that question before, right? Turns out I had a DVT, which is a blood clot, from my neck to my elbow on my left side. So I ended up getting admitted into a hospital, which actually, I'll let you know, it was a blessing in disguise. Nobody wants a blood clot. So I was in the hospital, and I also had the edema. And this is how much edema I had. They were giving me Lasix. They actually gave me a little bit too much, unfortunately, because you're only supposed to pull it off slowly, which I didn't know at the time. But they were able to pull off about 50 pounds of fluid off of me in less than 24 hours. Which, unfortunately, because I'm on the steroids, then my joints were all aching and I was just in pain. But I didn't know that. But luckily for this blood clot, while I was there, I ended up going into cardiac arrest. And it was because I had pulmonary hypertension, because of how much oxygen I was on, the need of the oxygen that I needed in order to, hold a good saturation. I ended up having pulmonary hypertension. If I wasn't in the hospital for the blood clot, I probably would have gone into cardiac arrest at home, and I wouldn't be sitting here talking to you today. Because of that, they ended up medvacing me to UC Health, in which I once again was blessed with wonderful doctors. I got both Dr. Badish and Dr. Bull for pulmonary hypertension. Lifesavers. And also, I found out, the cherry on the top, right? Oh, by the way, I don't know if they mentioned to you, but you have an autoimmune disease. It's called anti-synthesis antibody syndrome. Exactly. So there's, one good thing is that since I first got sick in 2007 I was bedridden, so I had a lot of time to look this stuff up on Google, which can also be the scariest thing ever, as you guys know. because it shows you information, but it also shows you pictures and it shows you information that you don't want to know. So you have to kind of take everything with a grain of salt. So once again, intubated, medically induced again for about 2 more weeks, repeat with the whole atrophy, and had to relearn how to breathe, walk, everything again. But I was kind of good because I figured I did this once, I know what to expect, let's go guys, okay? My doctor then said, hey, let's talk about a lung transplant. The only thing that was holding me back from getting listed was all the years of all the steroids that I was on. I had gained over 200 pounds. Well, at UCH, they have a lot of restrictions of the little boxes that you have to fit inside in order to qualify. The only thing I didn't qualify was my weight. Now, at this point, I was on 15 liters of oxygen sitting down. If I wanted to even talk, I needed 15 liters on both a nasal cannula and a mask, sometimes a non-rebreather. And I was going to pulmonary rehab. In fact, I've been going to pulmonary rehab since 2009. I started at National Jewish and then I transferred over to UCH. It's not easy to lose weight when you're on a lot of oxygen. I can't just jump on a treadmill and start running and go, okay guys, let's do this. I then had to see a nutritionist who then had to talk me into this is what you need to eat. I had to be very disciplined on my diet, and I was actually able to lose all that weight. Unfortunately, in the interim of losing all that weight, in 2012, my pulmonary hypertension had spiraled so out of control, I actually ended up in the medical ICU at UCH, and this was about July, maybe August of 2012. And because my body was working overtime, I kept losing weight to the point to where they said, okay, you need to stop losing weight because if you lose any more, we're gonna have to take you off the transplant list. Can you help a girl out? I mean, come on, guys. Never had a weight issue until I got sick, but you know, it is what it is. So there I was, trying to eat as much as I can with as many calories as I can, because as you know, if you eat too much with respiratory issues, then it's hard to breathe. So it's trying to find that happy medium in between. So lo and behold, September 29th, I get a lung transplant. I get beautiful, healthy lungs. And because of that, now I sit here talking to you guys, you know, breathing through someone else's lungs. And I am very grateful for it. I am very blessed. I wake up every day and I take a deep breath and I think, whoever it is that's out there, because I know everybody believes in different things, that, you know, thank you. And it wasn't always a successful recovery. In fact, because I was in the hospital for so long prior, third time's a charm, right? Atrophied. I mean, I already knew what the PTs were gonna tell me to do. I was like, okay, this is what we're gonna do, all right, let's do it. I could have given them a game plan of what we were gonna do, so. Unfortunately, at that time, I started to get a hemothorax, which was bleeding into the space between the lungs and the chest wall. I don't know the exact name of it, but I ended up having what they call a lung decortication to get rid of that. So that was a little bit of a setback. But at least I can say, last week, I made 6 years. Thank you. And I owe it to everybody that's in my life. I mean, I look at the hospital staff and the doctors and the RTs and anybody who has touched my life within this journey, and they are my family. I mean, there's so many times that they could have looked at me at how bad my situation and said, you know what, there's too much, just give up. I know people who have less than me that doctors have said, sorry, we can't do anything. And I think that was one thing that kept me going, was because I looked at it like, these people never gave up on me. How do I have the right to give up on myself? You know, and I've been very, very blessed, like I said. I mean, my family is extremely supportive. My parents were taking care of me for 5 years that I was bedridden, washing my clothes, making my food. I mean, my brother stopped working for 4 years just to take me to doctor appointments. And I had multiple doctor appointments in one day, multiple times a week. And let's not get started on remembering all that info that you get from those doctor appointments, right? And I actually had a sister who would take time off from work, and she would go to every single doctor appointment and write all the information down so that I would later say, hey, what did the doctor say about this med, or what do I need to change, or what do I need to start exercising? This was before open notes. She wrote all of this down, and then she would email it to all of my siblings and my parents, just so everybody was on the same page and knew what was going on. And I think that helped them also. So, you know, it wasn't an easy journey for me, as you've heard. But there's several things that I'd like to say to everyone here. That some of it I wish that someone had told me early on. And I think one reason why I didn't hear it was because it's not something that I gradually came into. It was something that hit me like an 18-wheeler at once, and complete culture change for me. And one thing I can say to you guys, actually there's three things I want to say, but one is control what you can. And what I mean by that is you can't control if you have an exasperation, but you can control by calling your doctor and saying, hey, something's not right. You know, you can control what meds you take. You can control by showing up to your doctor appointments on time, ready, prepared. And what I mean by prepared is ask questions. You know, if I've myself learned the hard way, I started carrying a notebook around with me, and anytime anything came to mind, I would write it down. I had so many questions for my doctor's appointment to where Jeff would tell me, hey, Bella, why don't you just email them to me? That's how many questions I had. And he was willing to answer every single one. I would email it to him like maybe a day or two, and sometimes he would just email them back to me. So when I saw him, we could even maximize even more the time that I spent with him when I did see him. So we weren't talking about frivolous little things. We could actually get to the heart of things and talk about what really mattered. You know, other things, being compliant with anything. Exercising. I was in pulmonary rehab for years. In fact, even 6 years out, I still go to pulmonary rehab. I go twice a week, Tuesday, Thursdays in the afternoon, for multiple reasons. That's my family. I mean, you go there and you have those patients, and it's not a support group per se, but it's your support group. You know, there's people who know what you're going through. They may not be able to help you, but just a listening ear. Or maybe there's someone new who they can pick your brain, or there's someone who's been there for a while, you can pick their brain to get tips and tricks, you know. Work smarter, not harder. You know, there's a lot of things I wish I had known, you know, that I've learned just from there, not even necessarily from the therapist, who have been a godsend themselves. Don't stress out over what you can't control. That was the hardest thing for me. I was a super control freak before I got sick, to the point to where I had family members telling me I was CDO. I was so OCD, I had to put it in alphabetical order. You know, there's no sense in freaking out about things that you can't control. You're gonna get angry, you get yourself worked up. It's all this negative energy, and what does it do? Nothing. It makes you tired, it makes you exhausted. You know, why not take that energy and put it somewhere positive, like focusing on your breathing? You know, having that positive attitude is a must. When you're that negative, you can actually make yourself more sick. Nobody wants to be sick. Nobody ever wants to be sick. No one ever wants to be in the hospital. And I know sometimes it's very hard, because there was a point where everyone kept saying, oh, just take it one day at a time. And I was like, I swear to God, if someone says take it one more day at a time, I'm gonna freak out if I can. Sometimes a day just seems too long. It just seems too long. To where I would have to challenge myself, okay, let's just get through this breathing treatment. Once we're done with that breathing treatment, then we'll deal with the next thing. Or let's just get through this next 5 minutes. Sometimes you have to break it down into something just that simple and something that small. And it makes a huge difference. And I always had to tell myself, you know, tough times don't last. Tough people do. I'm a tough person. I have Boop. Boop does not have me. And I know that sounds very cliche, but it was something that small that just helped me every day. Tough people, or tough times don't last, tough people do. The second thing I would tell you is keep busy. Always keep busy. Even if you're not moving around, keep your mind busy. You have to keep your mind sharp too. Make to-do list. You know, you're still a useful, valuable human being. You know, you've had that sense of accomplishment when you finish things. I made to-do lists pages long, even something as schedule an appointment. You feel accomplished when you get these things done, and you get to see how much you actually do, even though you're not doing what you used to do. And the last thing that I would say is communicate with your providers. Everyone is different, and what works for one doesn't always work for everyone. And so you need to work with your doctors, your RTs, whoever is your healthcare provider, and be a part of your own plan of care as an equal voice. Work with them, don't let them work for you. Because when you do that, not only are you giving your buy-in, you're going to be more compliant, you're going to have better all-over outcomes, and the experience for all partners involved, and I say partners because you're an equal voice, the overall experience is so much better. So, thank you.
Hi, everyone. I'm Rob McGeed. I am a thoracic surgeon at the University of Colorado. One of my specialties is lung transplantation. I am a father of 2 young kids and a husband, and I'm an ARDS survivor. And it's pretty recent, so I get a little bit emotional, but I'm going to use some slides to illustrate the story that I'm going to share with you. And I'd like to thank both Bella and Joan for inviting me to share my experience with you. And out of disclosure, Bella has been a patient collaborator research partner with my team for the past 2 years, and I can't thank her enough the input she's given us, so thank you. So this is about a year ago. My wife and my kids, my son at the time was about 6 months old, my daughter just 3.5, and we moved here to Colorado after my cardiothoracic fellowship training finished in Seattle, and have been spending our times when we can, when I'm not in the hospital, enjoying the state, this beautiful state we live in. And this was on a visit, my first visit to URay. It was phenomenal. In December, I finally had 2 weeks off work, which is unusual for us. And we planned a family vacation, a lifelong dream to go to Australia, see family. I have a cousin who lives there and some other family. And then also show my kids kangaroos and the wildlife of Australia. We left on December 16th. See if this works. Yep. We spent a few days in Melbourne with a cousin, and then we went down to this little island called Kangaroo Island, which was a dream. Beautiful beaches, all this wildlife, kangaroos running around wild. There are my kids playing on the beach. December 22nd was great. December 23rd, we went for a walk on the beach, had lunch, and then drove up to the village about 50 kilometers away to get supplies, some food for the long weekend of Christmas and Christmas Eve and Boxing Day celebrated in Australia. While my wife was in the car, I became profoundly ill. Couldn't breathe, was coughing, felt terrible. And she came out, and I had crawled into the passenger seat. She had to drive us back to the hotel about 25 miles on the wrong side of the road for the first time ever. And she was scared, and I couldn't help her at all. We got home. I climb into bed. My family spends the rest of the day playing and stuff, and I was coughing so much that my wife slept in bed with my kids in the next door room. As the sun came up on the 24th, I was coughing up blood. I could see into my hands that I had frothy blood in my hands. And as a surgeon and taking care of patients who have lung disease, I knew I couldn't breathe, that I had lung failure. And as a previously healthy 40-something-year-old, it was pretty harrowing, and I'm sure many of you have been through similar situations where you're starting to confront your own mortality. I banged on the wall, got my wife into the room. She helped me get into the rental car, packaged the kids in. We drove 25 miles back up to the hospital, which was about the size of the bathrooms here on this little remote island. And I sort of stumbled in past the front door and walked into the emergency room where there were 2 nurses sitting there waiting for their shift to end at 7 a.m. And I was blue, my lips were blue and my skin was gray. And I said to them, I can't breathe, I can't feel my hands and my toes, I'm coughing up blood, I'm in shock, and I'm a physician in the US, just so they knew I wasn't some crazy person walking in. And they knew it. They lay me down. took some blood work, told me what the labs were, called in the doctors. Within a couple minutes of showing up, the 2 doctors on the island were there, and they put a breathing tube in me. And I didn't know if I was ever going to see my family again. I was asleep. Over the next week, a lot of things transpired I wasn't aware of. I had been flown by a helicopter within half an hour of having the breathing tube placed to the mainland, to a big academic hospital in Adelaide. I was on full ventilatory support. My kidneys had failed. I was on dialysis. This is a picture of me 2 days later, or actually the day after I got there. My wife had gathered the kids. One of the nurses had helped her get over to the mainland. My mom flew out from the U.S. to take care of me. About a week later, I was woken up. It was, as Bella had been, I was in a medically induced coma to help me breathe. I was on nitric oxide to help me breathe. For a little while, they considered me putting on a heart-lung machine to oxygenate my blood because I couldn't breathe enough. And they woke me up on December 30th, got the breathing tube out, explained what had happened. I had had a virus, probably from my son, the flu, the common flu, and I'd contracted group A strep pneumonia, which is unusual, has about an 80% mortality, so only about 20% of people who contract it survive. And probably got that on the plane, on the local plane, flying down to this island for vacation. And was on a ventilator, as you'd seen, was on dialysis, which is the big machine on the right on the corner. When they awakened me, they got the breathing tube out. The next day, they took me outside, and I saw my son walk for the first time. In the week I was asleep, he'd learned to walk, and that was just hard to miss. I'm sorry, I'm so verklempt. It's fresh memories. On December 31st, where we'd originally planned to watch fireworks, I was lying in bed. It was getting harder and harder to breathe. And on the January 1st, 6 a.m., the team came in and said, we have to put the breathing tube back in. I still had pneumonia. I had acute respiratory distress syndrome, which Thomas Petty is one of the physicians who helped develop understanding of it. And so they put the breathing tube back in, and at that point, I knew it was bad, and I didn't think I'd ever see my family again. Over the next 3 weeks, I was in a medically induced coma. On January 15th, my family had arranged to fly me back to Denver. And we stopped in a few islands along the way. My mom sat with me on the plane. I don't know any of this. I don't remember any of this happening. Finally got back to Denver and got me back to the intensive care unit where my own patients go at University of Colorado Hospital. And I was fortunate. I had great resources in Australia. It's amazing the care they gave me. They kept me alive when, if I'd been in an environment with lesser care, I probably would not have survived. Back at the University of Colorado, I was in the care of a lot of the people you mentioned, who I know all of them through my own work and now through my own illness. My partners, one of my partners is actually Bella's transplant surgeon, who's a close friend of mine, one of the 4 of us who does lung transplants. He took care of me as well. On the 20th, I was starting to come around back at home. My sister's in the corner, my wife, my daughter, my son sitting in my lap. I actually don't remember that picture, but I was waking up. I had lost 35 pounds. I didn't have a lot to lose when I got sick. I used to play hockey, climb mountains, and on the 25th, they stood me up, and I fell over. I had lost so much muscle mass in my legs. I'd successfully weaned off the ventilator, which was phenomenal because I was on nitric oxide, which is what we put patients on whose lungs aren't working. And was finally, my lungs had healed enough from the ARDS that I was tolerating a face mask and intermittent oxygen. And I know a lot of you know much more about that than I do as a patient. And I'd only experienced that as a provider, so it was a big role reversal for me. But as Bella said, as one of your points was, you've got to keep fighting, and we all have done that in this room. We pushed on, finally got out of the hospital after a week in rehab, in physical therapy rehab, getting me to walk again, able to stand up, take a shower. As a 40-something-year-old who never took any medications, I get home. That's what my daily regimen was when I first got home. After being home for a month with physical therapy at home, my own regimen from the physical therapists, sitting in front of the TV watching the Olympics, thank God for the Winter Olympics. I had something to watch, sat at home exercising while they watched curling and all sorts of boring sports. Finally, in the middle of March, I was able to take my dog for a walk for a mile, which was the first time in 3 months. Obviously, I've made a recovery if I'm sitting here, and I can tell you it's hard to be in the shoes that you're all in. It's a new experience for someone who had never been through it before. I went back to work in April. I made a vow when I was an inpatient that I'd get back to work. Started seeing patients again on Monday, April 2nd. But with much help from physical therapy and occupational therapy, when I left the hospital, when I left the hospital, I had a tremor just from muscle mass loss that with lots of exercise had gone away and was able to start operating about a week after I went back to work. It took a while to rebuild my stamina, but finally it's back. I've done 5 lung transplants in the past few months, which is again, the reason I'm here is to take care of patients. So it's been a phenomenal experience. The recovery was incredibly hard. The inpatient recovery, I was asleep. I didn't know what was going on. But the outpatient recovery was a great challenge. Made it back to the point where last month we were able to go back to Ouray and tolerate the altitude and start hiking again. So, again, I'm sorry, it's such a fresh experience. It brings up a lot of memories. But, and I've obviously had a lot of thoughts about this is how it's affected my life. But when I think about as a provider, and there's some lessons, and these are just sort of a sampling of the lessons that I've learned as a provider and how this relates to the experience and how it has shaped me. You never know what the person sitting opposite you has experienced. You know, I've known Bella for 2 years. I haven't heard the whole story that she went through. She's a phenomenal colleague in our research, and to hear what she's gone through is it's astounding. And same with Sue. And you just don't know who the person opposite you is. You don't know what their experience is. As a provider, we really need to listen to our patients and their families. I cannot understate the importance of family support in our patients, and as a surgeon, to have families be able to help their patients in their recovery when I only see them for a brief experience and encounter is phenomenal. Patients, unfortunately, really don't know what to expect with their illnesses. We can do a lot of reading. We can look things up online. We can talk to our physicians. As a physician, I can talk to my patients, but patients don't really have the same experience that we do as a provider and don't know what to expect. And so it is incumbent upon providers to really try and connect with the patient, explain to them what's going on, and the families. Families similarly don't know what to expect, especially families who aren't engaged all the time with what's going on with the patient. And so this experience has reiterated to me the importance to connect with families, have families in the room with the patient when we're talking about their illnesses, and so that the patient can have a support system. As a surgeon, I operate and then take care of the patients, but I don't always get to see what happens to the patients after they leave the hospital. I see them on intermittent visits back to me. But I don't know what else is going on in their lives and their minds. And as a patient, it became paramount to me that the support services of respiratory therapy, physical therapy, occupational therapy, the dietitian, are so critical in the recovery. And I knew they were in the past, especially as I treat lung failure patients with lung transplants, but this really reiterated to me their absolute importance in the recovery of the patient. I think it is paramount for us as physicians and providers to improve the communication of risks of treatment, especially as a surgeon, to patients and their families. And my research for the past 6 years at University of Colorado has been on improving surgical risk assessment and communication, but with Bella and 2 other patient partners who've been engaged with our research for the past 2 years, we've really started to make inroads into how to communicate that, as have a lot of researchers around the globe. And it is really important as a provider to figure out how to communicate to patients and connect with them and transmit the data so that they can think about what's going on and make really well-informed decisions, as opposed to the old paternalistic provider telling the patient what to do. And Bella said that earlier, it is a partnership in care. And finally, as a provider, I think there needs to be an increased emphasis on the patient's input and their feedback in their care. And in the past decade, there's been a movement, very slow movement, towards patient-reported outcomes and measuring patients-reported outcomes and incorporating patients-reported outcomes. In surgery, it's only been limited recently in orthopedic surgery, but we're trying to make inroads in patient-reported outcomes pre-operatively and post-operatively in their care, being disseminated and introduced and implemented. And again, that's where I feel fortunate to have worked with Bella for the past 2 years, where we've been trying to really improve this. Again, I've had a lot of other thoughts at the personal level, but these are really what strike me as a provider in the role of a patient and then back as a provider again. I hope we have an opportunity to answer some questions today. Thank you.
So if you guys have questions, write them down. We're going to get these on the website just because we are just a little past time. But do we have Kleenexes on every table, for God's sake? What a wonderful panel. Thank you so very much. I've lost my makeup. Thank you. But we appreciate this very much. As they said, you don't know by looking at these 3 what their walk has been. So wonderful. Thank you.